Pepper, hot condiments and spices. What happens is these irritate the stomach. They make the stomach so it starts putting off more acid. When there's more acid in your stomach, the acid starts causing cell breakdown. When the cells get destroyed, they bleed a little bit. And this is hard on the lining of the stomach. It creates inflammation. For example, red pepper, cayenne pepper, increases the amount of acid in your stomach by 700%. You know that animal protein is much harder to digest. It's much more tightly wound. And so it takes a lot more acid to digest it. And so same thing happens. It increases inflammation. Black pepper increases it by about 400%. And so anything that's hot will tend to increase the inflammation in your stomach. Sugar. How about sugar? How about refined carbohydrates? A diet high in refined carbohydrates negatively affects the balance between antioxidants and free radicals and tips the scale toward more and more inflammation. Why do I say refined carbohydrates? For example, a breakfast consisting of a bowl of cornflakes, skim milk, a piece of toast, and a glass of orange juice turns almost instantly into 16 teaspoons of sugar. Well, what will that do for me? That'll raise the inflammation in your body by 240%. Better to eat the oatmeal we talked about. Something that's not refined and won't turn to sugar in your bloodstream instantly. There's certain sugars that are especially bad. High fructose corn syrup, or fructose from any source that's refined. It's like a stimulator to the white cells to cause inflammation. It's like pushing their buttons. Cause inflammation. And that's exactly what it does, especially in the blood vessels and the liver, increasing the risk of an autoimmune disease. Well, what do they have fructose in? Everything. Soda and bread and donuts and pastries. And it's cheap. It takes less of it to create the same amount of sweetness. It's highly available, and so they stick it in everything. So you got to read your labels. Could I have crackers with my soup, please? Yeah. But what are crackers? Soda crackers. They're raised with baking soda or baking powder. What's baking soda? Antacid. Way antacid. And so when your stomach, which needs to make acid, gets a bunch of baking soda in it, it has to work much harder to get the pH down. If you don't get your pH down to 1, your protein digestion enzymes will never get turned on. And so the stomach has to work way harder. And when it works way harder, it starts doing that same thing as taking pepper. It starts microbleeding. Baking soda and baking powder are associated with a 190% increase of stomach cancer. A cancer that often results from, first of all, increasing inflammation. Then you get an ulcer, and it keeps healing, and then it doesn't know when to stop healing, and it becomes cancer. And so baking soda is a huge cause. What's baking soda in? Besides crackers? Bread, some breads, donuts, pastries, cakes. A lot of stuff. They put it in, bottles of lemon juice have baking soda in it. You have to watch your ingredients. Back in the old days, back when we were settling America, we didn't have all these processed foods. And so it wasn't such a problem. Now we have all these processed foods that, well, they're dangerous. Do you have any skeletons in your closet? Should we look? What do I mean by skeletons? Stuff you maybe don't know about, in fact, like mold. Mold in your basement. I was out in Maryland, and a family came up to me, and there was mother and father, and they were from Trinidad, I think, and the daughter had this really straight brunette hair. And I'm thinking, this is unusual, Mom and Dad have this curly black hair. And I looked at her, and they said, we want to talk to you. And I said, okay. And he says, our daughter doesn't have any hair. And I looked at her again, and they said, oh, that's a wig. And I said, really? No hair? And they said, yeah, no hair. And I said, well, what happened to her hair? They said, we don't know. I said, does she have hair anywhere on her body? They said, not right now. I said, not right now. I said, has she in the past? Oh, yeah, she used to have plenty of hair, and sometimes it starts to grow back and then it disappears. And I said, really? And I said, has when was the last time it started to grow back? And they said, well, she went off to her grandma's house up in some other part of the country, and while she was there, her hair all started growing back. But then she came home, it all fell out again. I said, oh, really? I said, has that happened before where she went away and it came back? They said, yes, she went to summer camp. And it started to come back. And Mom could hardly speak. Her voice was kind of, you could tell it was, raspy and inflamed. And I said, do you have any mold in your basement? They said, yeah, we do. I said, that's got to be it. You got a moldy environment. The inflammation's going up in the kid. She's reacting to her hair. It's all falling out. I said, they said, well, what should we do? I said, move. Sell the house and get out of there. They looked at me like, no way. It's our house. We own it. But, yeah, this stuff will kill you. And shade trees too close around the house. Shrubbery dense around the house. When we lived up in where we were living in Maine, the back side of our house where the sun never hit grew all kinds of stuff, and mold and lichen and stuff, and you power wash it off once in a while. Anytime you have decaying leaves, compost piles, wet basements, sauna baths, swamps or lowlands, living near a swamp, that'll do you in. Very dangerous. All sources of inflammation. So that's all aflatoxins. But these aflatoxins aren't just limited to your environment. They can also be in foods. Foods that are created by rotting, spoiling, aging, fermenting. And these will have these aflatoxins. Cheese, wine, vinegar, anything created by rotting, soy sauce, you name it. If it isn't fresh, there's a good chance it will have some of this aflatoxin in it. For example, cheese. It's a big question whether or not there's anything left of the original milk product. The bacteria did a number on it. And it's a high-fat food. Is it fresh? And so it gets oxidized lipids. It has all these aflatoxins in it. And so it is a big source of autoimmune disease. Some of the autoimmune diseases, they can point right to cheese. And people stop eating their cheese, it goes away. I've had people come and tell me, yeah, I quit eating cheese and my, SLE or whatever, it disappeared. Wine. And this is a huge factor for asthma. People who drink more wine have more asthma. It exacerbates it, makes it more likely to happen. It increases the inflammation in the body. Oil and vinegar on my salad? Where's vinegar come from? Rotten apples, for example, right? A lot of health food stores are selling rotten apple juice. They call it apple cider vinegar. What happens if I take a rotten apple and I throw it in a batch of fresh apples? What happens to the fresh apples? They'll get rotten in a hurry, won't they? What happens if I take and juice that rotten apple, make rotten apple juice out called vinegar, and put that on my salad? Well, you just made all your salad rot in that nice warm spot down there in your middle parts. It just destroys all the good ingredients you had there to eat. And if they want to create a model in which they can study ulcerative colitis and Crohn's disease in a rat, they'll just put weak vinegar solutions in his colon and intestine, and he'll get ulcerative colitis or Crohn's disease. So they can study it. I was up in Maine, and one of my friends called me up, a family that we were friends with, and the wife says, I want to talk to you. We have a problem with my husband. He's been having blood in his stools and mucus, and he's been having cramps and pain. We went to the doctor, and they did a colonoscopy, and they say he has all these ulcers up and down his rectum and colon, and he has ulcerative colitis. And they want to put him on a drug, and they say he'll be on this drug the rest of his life, some kind of sulfa drug, and she wasn't very happy about that. And so is there anything we can do to fix this and help it without going down that route? She said, we talked to the doctor, we said, we want to try to fix it. He says, okay, I'll give you 1 month, and you come back, and I'll do another colonoscopy and see if you did any good. Okay. So I said, all right, well, we got 1 month. Let's see what we can do. And so I started asking her a list of questions I usually ask people with the autoimmune diseases. I go down what I call the 8 natural remedies New start, nutrition. I ask them what they eat for breakfast, lunch, supper. Exercise, how much exercise they get outdoors. Water, how much water they drink. Sunlight, how much sun do they get on their bare skin. Temperance, what are some of their bad habits? You know, smoking, drinking, alcohol, drugs, caffeine, whatever. How much air they get, how much rest they get, how much stress they're under, and that kind of thing. And so I went through that list, and I went through a few environmental toxin questions, and when I was done, I had a pretty good profile and could see there was some lifestyle changes they needed to make. And so we put them on a program. First of all, they had to throw out a few things like ice cream and cheese, and they had to eat a few more things like, fresh spinach and, fruits and vegetables. And then we put him on a program to get rid of the ulcerative colitis. I had him start taking charcoal powder with water a couple times a day, tablespoon twice a day. And I had him initially do some charcoal enemas with the same solution. And then we had him doing hot and cold sitz baths. 2 buckets of water, sit in one that's hot for 3 minutes, and then an ice cold one for 1 minute. 3, 1, back and forth, hot and cold. Well, in about a week, she called me back and says, well, I just had some questions, the bleeding is totally stopped. He still has a little bit of mucus, a little bit of pain, and wondering if we could change this. We changed a few things. Week later, she called back, well, no more blood, no more mucus, and just a little bit of pain, but he's doing much better. The end of the month, when they went back for their colonoscopy, the doctor gave him a clean bill of health. No more ulcerative colitis. I called her, or emailed her, and well, it's been 3 years now. I emailed her within the last couple months because she was asking me some other things about somebody else, and I asked her about her husband and says, how's he doing? No ulcerative colitis, no Crohn's, no blood, no mucus. So we had him off vinegar. We made sure he didn't have anything tight around his waist, a bunch of other stuff. A lot of these people have trouble with gluten. They did a study on patients. They had 2 groups. One group had an autoimmune disease, the other group did not. And the way they did this study is they put a colonoscopy up them, and then they fed them food to see what would come down their intestine. So it's a very unusual test. And when they did that test, they discovered that when they fed the patients who already had the autoimmune disease gluten, they had 10 times the incidence of reaction to gluten as individuals who were normal. Did it show up in blood tests? No. Did it show up in skin tests? No, you don't wear your food. It only showed up in the colonoscopy test. So on my autoimmune disease patients, I usually give them a trial of a gluten-free diet to see if that has any effect. One of them, within a day of getting off gluten, she was normal again. And it wasn't a big autoimmune disease. It was more of a pain and cramps and so forth, just starting out. But what's the most inflammatory thing for the body? Well, we already mentioned meat a little bit, didn't we? Here we have a study where they are looking at the percent of diet as meat. Here is the prevalence of an autoimmune disease, in this case rheumatoid arthritis. In the United States, we get about 13% of our diet as meat, and we have a fairly high rate of autoimmune disease. But notice, all the countries line up on the line. The more meat they eat, the more autoimmune disease they have. When you're chowing down on the muscles of some animal, your body has a hard time telling, is that my muscle or his muscle or their muscle? Whose muscle is this? And so it overreacts. It doesn't know what to do about it, and it often doesn't have good tolerance to that kind of thing happening. And it shows up in autoimmune diseases. And so they did that colonoscopy study, and they looked at different foods. And they looked at how much inflammation there was related to those foods. Dairy was off the charts. Eggs, 600%. Pork, 460%. Fish, I was very surprised at that. Usually people say fish and fish oil help autoimmune disease, but in this study it was very clear that fish was a huge part of the problem. And so we don't recommend fish. Besides, it's very hard to find a clean fish. I mean, when I was in Maryland, where we're headed again, they gave me the newspaper for that day. Front page, don't eat any fish off the coast of Maryland. They have toxic levels of PCBs. I was up in Chicago. There was a restaurant. It said, if you are pregnant, don't eat fish here. You'll have too high levels of mercury. If you go up off the coast of Alaska and catch a salmon in those pure cold waters, it'll have toxic levels of DDT. And so it's very hard to find a clean fish, and that's probably why the fish have become so inflammatory. Well, let's look at how high your risk of disease goes up with different foods here on this chart. Acquiring an autoimmune disease. For example, eating lots of sugar increases the risk by 430%. Eating lots of cholesterol, either from other sources or from eggs, increases it by 360%. Saturated fat, animal or coconut oil, increases it by 300%. Soft drinks with all that fructose by 300%. Vegetable fat, like corn oil, only 22%. And if you're eating the corn instead of the corn oil, or eating olives instead of olive oil or whatever, olive oil might help you, but soy oil and so forth, it tends to increase it, but not nearly as dramatically as these other things. How about coffee? 4 cups of coffee per day increases the risk of an autoimmune disease by about 120%. Coffee the caffeine tends to make the inflammation go higher. It's like pouring gasoline on a fire that has already begun. And so it raises the inflammation up and up. So I had a gal call me from northern Maine. She was in her late 20s. She had been taking eye drops for pars planitis of the eyes, an autoimmune disease that can make you go blind. And so she's taking steroid drops for a year, and the steroid drops got rid of the inflammation out of her eyes. Not completely, but so she could function. And then after a year, the steroid drops made her eyes have too much pressure, glaucoma. So then she had to take another drop. So now it's 2 drops in her eyes. And for a year, this went on, taking 2 drops. So this is the second year. And at the end of the second year, then they checked her eyes. The inflammation was back and the pressure was back. The drops weren't working. And so the ophthalmologist said, well, let's put you on methotrexate because these other things aren't working. Well, she talked to her mom, who was a nurse, and Mom said, methotrexate? We give that to cancer patients. Why are they giving you that? Oh, no, look at the side effects. You might go sterile, you might lose your hair, whatever. And so the mom called me, and then the daughter called me, and they said, we want to get over this naturally. So I said, okay. So I went down my 8 natural remedies list and asked them all the questions and environmental questions and so forth, and found some things that they could definitely be doing different. And then we put her on a program, doing hot foot baths and cold fomentation, charcoal fomentations to the eyes, hot and cold treatments to the eyes, lots of exercise, more water to drink, lemon juice in her water, fresh lemon juice, all kinds of things. And within 3 days of starting the program, the halos she had seen around lights for 2 years went away. No longer blurry vision. And by the end of the week, she was supposed to go back to her doctor. She went back to the ophthalmologist, and he looked in her eyes. Oh, good, the inflammation's going away. The pressure's great. Okay, let me see you back in 3 weeks. So she came back in 3 weeks, and he looked in her eyes, and hey, no more inflammation, pressure's fine, it's great. Boy, that methotrexate sure is working wonders. And she says, well, I have a confession to make. She's kind of a shy gal. I have a confession to make. Oh, what's that? I haven't been taking the methotrexate. Can I tell you what I have been doing? Okay. What have you been doing? Well, and she told him, and he's like, I don't know. I might be missing something. Let me have you come back in 3 weeks. We'll check you again, just to be sure. So she came back in 3 weeks. He looked in her eyes. Inflammation's totally gone. He checked the pressure. He says, well, I don't know. I might be missing something. I have a friend down in Boston who's a research ophthalmologist that's doing research on pars planitis, this inflammation in your eyes, and I'd like you to go down and see him. Okay. So she went down to Boston, sat in this office, and got taken in, and the ophthalmologist looks in her eyes, and he says, you don't have pars planitis. And she says, can I tell you how I got rid of it? He says, no, and don't tell anybody out in my waiting area either. And so we were in contact with, that's 3 years ago, and she went on the radio and talked about this just recently, and still is fine. And so these things can be cured naturally if you treat the immune system right and get it pumped up where it belongs. All right, smoking, full of all kinds of inflammatory things. I mean, it's burning, it's embers. It's not a dietary supplement. It's just plain smoke. So this really does a number on your immune system. I mean, your immune system, you have these antioxidants to deal with, naturally occurring problems in your body, and then you dump a whole slug of extra oxidants on it, and you just used up all your antioxidants to take care of the tobacco smoke, and now you're out of antioxidants and you're in big trouble. So smoking is a major problem. When you eat too much food, the body doesn't know what to do with it. It's like building a bigger fire than you can contain, and it creates inflammation. That extra food really adds to the inflammation. It creates aging. You get older faster. It does all kinds of things to you. On the other hand, if you eat less food, we call it caloric restriction, then it reduces inflammation. In fact, in some of the studies in Scandinavia and in Japan, where they take in a bunch of rheumatoid arthritis patients and they want to get their disease under control, they'll study them for 55 days. During that time, they'll have 3 fasts, each for 3 days. The fast greatly brings the inflammation down in a hurry. And then they put them on a total vegetarian diet and avoid gluten and have great success. And so fasting or eating fewer calories is a way, and they put them on a very low-calorie diet, like 1,200 calories per day, which is quite low for most people. On the other hand, you get too much weight on you, too much fat, and it increases the risk of an autoimmune disease by about 275%. People who weigh more have more of these diseases. You see, it has to do with this fat and what happens with it. Once you have reached maybe 4 years of age, 2 years of age, you don't produce any more fat cells. You get what you get, and after that, if you get more weight, the fat cells just get bigger and bigger and bigger. And the bigger they get, the farther it is from the outside to the inside. And the bigger they get, the less the fat on the inside can be attended to by the blood vessels on the outside of the cell. And the fat on the inside starts going rancid. And as it goes rancid, it puts off little rancid particles, oxidized lipids. These go through the body and increase inflammation, increase the risk of macular degeneration, hearing loss, Alzheimer's, which is very related to inflammation and autoimmune diseases, and kidney failure and so forth. And so just the cells getting big is a problem. The other problem, do you know what this machine here is? CT scan. And it gives you a picture that looks like this. Here's a normal person. A little bit of fat on the outside. It's a slice right through the middle. Belly button's right up here, right in the middle of her. Here's the backbone back here, kidney. And this is a normal person. There's some fat around there for sure, and that's normal. But notice there's also fat on the inside, but not much. You get over here to the overweight person, and not only do they have a lot more fat on the outside, those big cells that are poorly attended to, but there's a lot more fat on the inside. And this fat on the inside is always at a higher temperature. If we checked your temperature tonight with a thermometer, it would probably be 98.6 if you're healthy. But that's not the temperature it is down deep inside of you, especially if you have lots of insulation on. The temperature down inside you is going to be more like 100 degrees. And what happens to fat? Take a piece of meat, trim off the fat, and put the fat at 100 degrees for a while. What happens to it? Goes rancid. That's right. It starts to deteriorate. And that fat is deteriorating the same way inside you. It starts going, well, we call it oxidized lipids, lipid peroxidation, free radicals, oxidative stress, all kinds of these fancy words. It really means inflammation picks up. And so having extra fat increases your risk of an autoimmune disease. Heavy metals will do it to you. Like mercury, they sort of act as a catalyst to increase inflammation. Where do you get mercury from? Fish? Huh? Where else? Fillings in your teeth, says the dental hygienist. But another source is vaccinations, right? Vaccinations have a lot of mercury. And so this mercury increases inflammatory tissue damage. If you have rheumatoid arthritis, we bring you in every few years and x-ray your fingers to see if your knuckles are disappearing. If you have mercury in your system, they disappear at half again as fast as if you didn't have mercury. It increases tissue destruction. Well, okay, so we said mercury is in these vaccines. Receiving a measles, mumps, and rubella vaccine, which is usually high in mercury, they call it thimerosal and a bunch of other names, significantly increases the odds of acquiring chronic inflammatory arthritis. Compared to receiving a common tetanus vaccine, that's what they usually compare everything to, receiving a hepatitis B vaccine, which they give all the kids now, increases the odds of acquiring multiple sclerosis by 420%, lupus erythematosus by 800%, and rheumatoid arthritis by 1,700%. Mercury is a big problem. And it's hard to get out of your system. It accumulates. And so it's hard to get rid of. Better living through chemistry. And people who work in environments with lots of chemicals have more autoimmune disease, particularly mineral oils. If in the industry you work in there's a lot of mineral oil, there's a higher risk of these diseases. Also, hair preparations, especially dyes. Study after study. Dye in your hair increases the risk of rheumatoid arthritis by 90%. Something about those dyes and working in that environment. Another one is sodium lauryl sulfate. What's sodium lauryl sulfate? Well, dish soap is just about pure sodium lauryl sulfate. Shampoo usually has it. Toothpaste, skin moisturizing agents. And so a lot of the health food stores have shampoos that are SLS free and toothpaste that's sodium lauryl sulfate free, or potassium lauryl sulfate, or ammonium lauryl sulfate, whatever lauryl sulfate free. And so that you won't get that. So you can buy stuff without that.